Hello everyone, my name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and on behalf of our Chairman, Robert Doherty, and the rest of the Sullivan County Legislature, welcome to today's Town Hall. This will be our last Town Hall COVID related, I'll wrap things up later and mention a few things. But thank you for joining us all these many months and submitting your questions. And today we have with us our County Manager, Joshua Potosik, our Director of Public Health, Nancy McGraw, and our guest today, once again, is the CEO of Garnet Medical Center Catskills, Jonathan Schiller. We're going to start today, as we have other meetings, with Nancy McGraw. Nancy, welcome. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy, hope you had a good vacation, very much a well-deserved one.
Thank you. Good afternoon. It was a few short days off, but it was very much enjoyable. Thank you. So we're in pretty good shape. We have two more active cases this afternoon from earlier this morning when I mentioned it at our meeting. So we're up to 10 active cases that we are monitoring. That's an increase in 8 cases over the last week. However, those numbers are still pretty small, and we're in good shape. There are no hospitalizations. We're holding steady at 48 deaths, and there has not been an additional death in quite a while. 171 people are on mandatory quarantine, and to date, that brings our total to 1,428 who have tested positive since the beginning of March, when we started tracking positive cases. 3,374 people have recovered, and 14,703 have been tested. That increasing number of people tested is a good thing. That continues to go in the right direction, and we are looking at ways to partner, getting additional resources from the State Health Department for increasing testing capacity in Sullivan County, as well as in other rural parts of the state, as well as hopefully helping our pharmacies become able to tap into the rapid testing and make that more available to our community residents. We are dealing with the travel advisories in terms of people who travel to other parts of the nation, where the states are experiencing a huge increase in cases, and we're monitoring that very closely. That travel advisory is something that the governor has put out, and they may add additional states as time goes on. So I would encourage everyone to check the State Health Department's website for that information before you travel, because when you come back, you're going to be asked to self-quarantine for 14 days. There's a very good reason for that, and that's because we want to keep those numbers low. If you have any questions regarding the travel advisory, I would urge you to call the state's number for coronavirus hotline, 1-888-364-3065, or you can certainly go on the website and take a look at the most recent up-to-date list of states. And that's what we have currently.
Okay, thank you, Nancy. Another question for you as well. Will non-residents, or summer visitors, be counted in the tested numbers for Sullivan County? If not, why not, if they are tested here? Also, will summer visitors' doctors be required to release testing numbers and positive case numbers to Sullivan County? That's it.
So we have addressed this question in previous town hall, and one of the things that we've done is have some conversations with our local healthcare providers, including the hospital, with which Mr. Schiller can address when he talks about this issue later. But we have an ability to track the number of people who are tested by site, by provider, and the number who are positive. So we will be getting that information. In the end, the State Health Department tracks and counts positive tests by counting of primary residents. So in the end, the total numbers will be a reflection of full-time county residents only. However, we will have access to a different data set so that we know the number of people who are visitors who are testing positive while they're here. I want to underscore an important point, and that's that if somebody starts to feel ill while they're in Sullivan County and they go and get a COVID test, they are instructed at the time of their test to quarantine until their test result comes back. So it's not just a matter of numbers, it's a matter of protocol, education, and instructions that help keep us all safe.
Thank you, Nancy. Our next question, going to have Jonathan Schiller addressed initially, and then we'll go to Josh to wrap the question up. And it reads, has there been any discussion about allowing people to visit family in nursing homes? Maybe outdoors with masks and social distancing? Valley View Home in Orange County is allowing short outdoor visits with masks and social distancing. Can we try this? I haven't seen my mom since March. Jonathan?
Thank you very much. It's a good question. This is something that is very concerning to us, our nursing home population. I think we've seen in our state and as well as across the country that some of the residents of nursing homes and long-term care facilities are really the most vulnerable to this coronavirus or COVID-19. So at our nursing home, we are still very much restricting visitation to exigent cases and cases of imminent passing away. But on the flip side of that, we do offer and help facilitate FaceTime conversations between family members and residents, as well as WebEx and Zoom opportunities to communicate. And we're using some of our social media for our nursing home residents to communicate with families and vice versa. So far that's working. It's not perfect. I agree with the person who asked the question. We all want to get together as soon as we can, and we'd like nothing more than to provide full access. Right now, we're being very careful, we're being very thoughtful, and we all can't wait for the day when we can release all of these visitor restrictions. But out of an abundance of caution, we are going to keep them in place for the foreseeable future.
Thank you, Jonathan. Josh?
Thank you. Good afternoon. So echo everything Jonathan said. Obviously, the population is extremely vulnerable, and we've seen a lot of, as a percentage, deaths in the nursing homes, not just in Sullivan, but across the country. Something we've started just this week, and due to the layout of the facility, we're able to do this. I know all facilities can't do this because of their physical plant, but Monday through Thursday, we're starting what we're calling a drive-through visitation. If you're familiar with the facility, there's an outdoor little outside seating area that families can drive up, remain in their car, and in 10-minute intervals will be able to interact with their loved one. So that has started this July 6th. It's gone well so far. We've contacted the family members. If you are a friend of someone in the facility, contact the facility and we'll try to accommodate you as well. But it's something, and I echo what Jonathan said, ideally we want these restrictions lifted as soon as possible. I think early on was one of the more difficult decisions that the county had to make when we shut our nursing home down to visitation even before the state did. So we understand what this has done to family and being able to see their loved ones. So I think this is, while it's not ideal, I think we're trying to make our best effort to at least have some visitation there, even though you're in your car at some distance from your loved one. But like I said, it's gone well so far, and I think it's been really, from what anecdotally we've seen, it's really brought tears to some of the people's eyes that they finally get to see their family members. So I'd encourage you to contact the facility if you're not aware of this and schedule an appointment.
Thank you, Josh. Next question is for Nancy. It's a long one. I have made multiple complaints to the Department of Health, the Governor's Page, and even Spectrum News. I reside in Woodridge, and there are buses that come up every day to pick up kids for camp, who are all standing side by side on a packed bus with no masks. There are also many businesses within Woodburn and Woodridge where individuals do not wear masks. Governor Cuomo has said the local authorities have to do something. So what does Sullivan County have planned for the safety and health of their residents? Nancy?
We've had ongoing conversations with the district office in Monticello, which regulates summer camps. The Department of Health has given them some additional enforcement ability directly to deal with some of the camps who may not be in compliance. And we're working closely with them if there's any concerns about someone who is suspected of possibly being exposed or on quarantine, which really hasn't happened. We haven't really had a concern about that. There's lots of different types of camps, and we're not going to go over that again today. We're not planning to do that, but we will be preparing some informational documents and education for the public regarding that. So the enforcement of all of the regulations for health and safety for the camps and for summer visitors at the camps and temporary residents is the responsibility of the State Health Department. Local enforcement really involves education, following up on complaints. We get a lot of complaints through our office that come to us through the New York PAWS, and we do follow up on those. You may not expect to hear back directly from anyone because we simply don't have the resources to do that, but please be assured that we are following up on each one of those complaints when we receive them. Again, I think that it's really important for businesses to abide by the governor's executive order for requiring the use of masks. That's really important in order to protect everyone. And again, there's the complaint line if you feel that you need to call and report a business. We want everybody to do the right thing and take this seriously, because all it takes is 1 or 2 exposures, and then all of a sudden we'll have 20 or 30 more cases. So please take this seriously, and that includes the business community in terms of having policies to enforce the wearing of masks. And we are here as a resource. And again, that's a hotline for filing any kind of complaint regarding a travel advisory or someone who should be in quarantine or New York PAWS is 1-833-789-0470. And all this information is on the State Health Department's website at coronavirus.health.ny.gov.
Thank you, Nancy. I think it's important to remember as well with here in Sullivan County, with the influx of resident, or I should say our summer visitors, second home folks, where the population of Sullivan County has definitely increased. Everybody realizes this. But within that context, there's something positive to talk about and realize that with that influx of population, our numbers have, by no accident, our numbers are good. As Nancy just alluded to, we have 10 active cases. And that's because overwhelmingly people are doing the right thing. There's always going to be a risk, and we just look to minimize the risk. And that's what we've been doing thus far. And we just continue to do that. And we'll see these numbers that, continue to go down. So just remember that our population has increased, and because we are doing the right thing with our personal behavior and our decision making, that we're keeping the cases on a downward trend. So our next question is for Josh, and it reads, why is DMV working with such limited staff when so many other areas of the county are open? I called to make an appointment, and not only can I not get in until August 3rd, there was no one in DMV that could answer questions regarding the forms or fees I will need for my appointment. Josh?
That's a good question. Well, as of now, all but one position has been recreated by the legislature in the DMV office, and we expect to have that other position created next week. So they are virtually, certainly within a week, will be at full staff. I think to the public, I think you have remember that they've been shut down from local decisions, but even by the state at some point. So there's a big backlog. While we were still taking drop things through the Dropbox, there's been a backlog of people and pent up demand. So there's going to take a little bit of time for them to catch up to where they normally would be in terms of being able to process transactions. But I think over the next couple of weeks that should get better. And this is something that's kind of happening across the state as DMVs and even other states as DMVs were shut down, and now that they're reopened, you're seeing unordinarily long lines or unordinarily long time to get someone processed. So I think I'd ask for some patience, and I think the DMV would ask for some patience as we get through this backlog of transactions that they're sitting on due to them being closed for a long period of time.
Thanks, Josh. The next question is for you as well. Is there a phase 5? I only see 4 phases, but there are still restrictions on certain businesses opening and in capacity.
Yeah, another good question. No, there's no such thing right now as a phase 5, and I think important to point out is we're still operating under a state executive order, a state of emergency and executive orders that have shut down non-essential businesses. So the phased reopenings are allowed when meeting certain metrics, still under the executive order and the state of emergency at the state. I think, being on the calls with the regional control room, I think probably likely what will happen is as we get through 2 weeks through phase 4, you'll start to see more guidance on a statewide basis for certain clusters of industries, whether they be casinos, water parks, or even our schools. So I think you're going to start to see more guidance as industry, or gyms have been a big issue as well. So I think you're going to start to see, we'll probably remain in this phase 4 for a period of time, but you'll start to see more and more industries allowed to reopen with state guidance.
Thank you, Josh. The next question I will address. How are the county finances looking? Are there other options we could consider to balance our budget instead of selling the care center? In a word, our county finances are bleak. Through the county manager's office and the county legislature and other leaders of the county, all options pretty much are on the table right now, trying to get past a deep hole. Numbers aren't final yet from the state. We're still waiting on some of that. But we know that to one degree or another, it's not going to be good. So the whole goal, if at all possible, is to stay underneath the tax cap. That's the goal that we've embarked on. We're looking at a lot of different options. Today, our county treasurer, Nancy Buck, spoke to the legislature and the public that was here about, from her perspective, from her office, just how tough of a situation we are in. This has been quite a year thus far. That's an understatement. But our goal is to come out of this with a county that is not taxing, if you will, our county residents to something that is just unsustainable. So enough said on that, but there's work to be, to just stay tuned. But it's our financial situation is definitely not in a good spot. And on that somber note, we have three remaining questions, and they're for our guest today, Jonathan Schiller. And I just want to thank Jonathan once again for joining us. And Jonathan, before I get into the questions, is there anything that you would like to add today as far as your organization and how things have been since the last time we spoke?
Sure, yeah, thank you very much. I think I'll speak on behalf of myself and our hospital, but we'd like to thank yourself, Vice Chairman Brooks, as well as Chairman Doherty and County Manager Potosik, Nancy McGraw and her team, and the county's Office of Emergency Management, and everyone who has just done such a fantastic job leading our county through this challenging time. And these town halls are a great example of all of the efforts that are being made to communicate on a regular basis and being as transparent as we all can with the information that we have available to us. So we appreciate that leadership. As Nancy had indicated, I am thrilled to share with you that after last Thursday, we had discharged our last COVID positive patient. So this is a fantastic news for the hospital and really a reflection of what's been happening in the community over the past few months. It's been very hard work wearing a mask and staying away from our friends and in some cases our family, but we see the results of that playing out in the epidemiology within our community. So we just ask everyone to continue that hard work and do it for each other and do it for our children. I have some comments as we go through the other questions, but we're very fortunate and we're just very thankful for all the support that we've had from our community to keep our staff motivated and going through the past 3 months.
Thank you, Jonathan. And that first question is, how is the hospital preparing for a potential new wave of COVID cases?
Well, that's a good question, and we're doing a few things. The first thing that we're doing, and this is probably one of the most important ones, is that wherever possible, we are approving vacation for our staff to give our staff a chance to decompress from the intense clinical activity that they've been going through over the past few months, and to get everyone an opportunity to recharge our batteries, in some cases reconnect with our loved ones at home, and just get ready should we need to be. The second thing that we're doing is what's referred to as a hot wash or an after action report. We know we can always be better at everything that we do, and so we're taking the time now to review all of our decisions that we had made over the past few months and identify ways we could improve if we do have a second wave here in the community. We do continue to procure an above average amount of inventory of personal protective equipment, in particular the N95 masks as well as the gowns. We're building a small, I'll use the word stockpile, for the safety of our staff and our patients should we need it in the coming second wave. We are keeping our main surge unit that we had activated in a state of readiness. We haven't broken that unit down or put it back into other service. So it stands at the ready, and within a few hours, if we needed to, we could reactivate that surge area within the hospital. For visitors or guests and patients who do present to the emergency department, they will see that we are still continuing our respiratory care triage tent, and we're making some physical modifications within the emergency department so that should we have a second surge, we'll be able to continue to monitor patients' respiratory symptoms and other COVID-related symptoms prior to entering the building. And on that note, we are also screening all visitors and contractors who do present to the hospital to ensure that everyone who enters our doors is kept as safe as possible.
Okay, next question for you, Jonathan, is, have elective surgeries resumed, and how do you keep patients safe from coronavirus?
Good question. We're very fortunate to be in a position to have resumed elective surgery, and this is both for inpatient and outpatient procedures that we perform here at the hospital. It's not easy, but we're doing it right, and we think we're being very thorough and careful about it. So for patients who are scheduled for a surgical procedure, all patients do go through a pre-surgical checklist or screening process. And part of that checklist does now include a negative COVID-19 test result within the past 5 days and the patient's attestation that they haven't, that they've been following all of the guidelines between the negative test result and their day of surgery. For everyone's safety, the waiting room for families or friends in the surgery department is temporarily closed. We do support patient escorts or a family member to bring the patient in and to help them out. But during the procedure itself, we do not have any waiting within the facility, again, for everybody's safety. And then one thing we are doing with our surgeries is we're being very thoughtful about the order of the day and how we schedule surgeries. So, for example, if there's a patient who's going to undergo a procedure that may have aerosolization associated with it, a procedure like that would be scheduled at the end of the day when there's no one else around. And then finally, one thing we do, which is what we're all doing outside the building, is patients on stretchers and gurneys are physically distanced in each other preoperatively and postoperatively effectively to prevent any spread if there ever was a case.
Okay. And the last question for you, Jonathan. How is the hospital doing financially? Will there be layoffs or cuts because of the impacts of COVID?
Well, that's a good question. The hospital's finances are stable. Rural hospitals in New York have never had strong finances, but for a rural hospital in New York, we are very stable right now. And that's in large part due to the support that we've received from the federal government through the CARES Act. Many thanks to the elected officials in our area who supported this legislation. It's been very helpful for us and enabled us to purchase incredible amounts of PPE, medications, medical supplies, and quite frankly, increased wages as everyone here was working overtime over the past few months. Without that, we would be in a very challenging situation, but we've been fortunate enough up to now to be able to maintain stability. With regard to the question about layoffs or cutbacks, we have not and do not foresee any layoffs within our organization or any cutbacks of services. We did temporarily reduce the level of outpatient services out of everybody's consideration for everybody's safety, and those services are slowly reopening now. But we'll continue to offer all of the services that we had before, and we'll be here for our community.
Thank you, Jonathan. And I just want to make a comment. Jonathan and the hospital, the nurses, the doctors, and all the employees are a true asset to the county, and we thank you for everything you've done through this very difficult time and will continue to do. And we appreciate you've been our most frequent guest here, and we appreciate you taking the time out and explaining from the hospital's perspective what's going on and what's happening. So thank you once again, Jonathan, for being part of our town hall. And as I mentioned earlier, this is the last town hall regarding COVID-19. At some point, we'll probably we'll communicate out via a town hall setting, but that's later on. But for now, I'd like to thank Nancy Buck, not Nancy Buck. Well, I do thank Nancy Buck, but Nancy McGraw. She's been here since the beginning, and her demeanor, her information, and the messaging has been spot on. Has been a true asset to the county. So thank you, Nancy, for what you do and your staff. And I'd like to thank Joshua Potosek, our county manager. This is a tough time to be in any kind of business and any kind of leadership role, and it's no exception to Josh. And thank you for what you do, Joshua. There's a lot of work to still be done, but this has been tough on everybody, and Josh's leadership is appreciated. And then I'd like to thank the folks who have tuned in and sent questions. We love to hear from you. We want to know what's going on, what's on your minds, and so thank you for taking the time and submitting the questions. And there's too many folks to thank, but obviously the EOC and the ECAC are two organizations that come to mind, and the people that are part of that I want to say thank you to, because you've helped get us through this, and obviously there's still more work to do, but just a thank you to everything that you've done thus far. It's well appreciated, and I know the residents of the county appreciate it as well. And now as we move forward, there's going to be residual effects of COVID financially, and we're not sure how long that's going to happen, but rest assured that the county legislature, the county manager's office, we're going to do everything we can to get through this in a healthy, efficient way for the county, and to come out the other side of this, however long it takes, in a much better position. I've been humbled to sit here for a couple months and host these events. I've got a chance to meet people that might have not have met at least as quick as I have, such as Jonathan. And it's a true honor, and I thank the residents of the county for putting me in the position to try and help any way I can the county get through this. And I know that our chairman and the rest of the legislators think that as well. And so anyway, I want to close up the meeting to say stay safe, be well, and bye for now.